Hello, a very good afternoon to all of you. I welcome you again to today's FB Live. Once again, in our discussions on this FB Live, we have a newer dimension to our discussion, that is, what to do when you test a pregnancy test becomes positive or you are pregnant. So, today we are going to talk about pregnancy care in IVF conception. So, as we all know, that the indication for which we are doing IVF might be a higher age, higher maternal age. There can be some problems with implantation initially. There can be a risk of multifetal gestation or twin or triplet pregnancy. Currently, with the adoption of single embryo transfer or two blastocyst transfer, the risk of multifetal gestation has gone down. There is a slight risk of preterm birth, intrauterine growth retardation. Some people also think that there are multiple injections which are given after IVF pregnancy, and there is an increased risk of cesarean section as the mode of delivery. So we are going to discuss all of these scenarios. Some of these are myths and some of these are facts. So we need to accept the facts and to drive away the myths. So, first of all, when the pregnancy test becomes positive, it's an occasion which should be celebrated. Here at Oasis Fertility, we believe that not just the pregnancy test, but the journey throughout pregnancy should be a positive one. And therefore, today's discussion about pregnancy care in IVF conception. So, once the pregnancy test is positive, the next question comes in the mind of the woman is what to do. Suppose your pregnancy test is positive, the first and foremost thing is you consult your doctor. If you have done a urine pregnancy test, you have to consult the doctor immediately. Sometimes these tests are done in the clinic itself in the form of a blood test, which is the serum beta HCG levels. Once these tests are positive, you need to continue with all the medications which have been given to you. This especially include the folic acid, vitamin B12 combination, and other necessary drugs which are given to you. We try to keep the number of drugs to as minimum as possible during this period. This pregnancy test usually is done at around 15 days after your embryo transfer. So roughly, you are around 4 weeks pregnant at that time, and after that you see for ultrasonography, which will confirm the pregnancy and will confirm the number of gestational sacs present. So that is done after 15 days, usually after the pregnancy test comes positive, and this period is around 6 weeks of pregnancy. So friends, till then, usually the point of contact now decreases. So usually you have a habit of visiting the doctor too frequently whenever the cycles are going on. You have a number of medicines which are being given. You are have the number of ultrasonographies which have been done. So you may feel a sign of hollowness, or you may feel what to do next. But this is the time where you should stay focused. You should keep calm. You should not uh, make your queries be answered by Dr. Google. You should refrain from using Google to answer your queries. You should ask your obstetrician and gynecologist. You should read definitive or authentic blogs which are given by specialists in this scenario, and then take an opinion about this. So 6 weeks is where the period you come for the follow-up to the consultant, and ultrasonography is done. The ultrasonography will tell whether the number of sacs present, the viability of pregnancy, whether the heartbeats have come or not, and general well-being of the fetus and the mother. So all this is done at around 6 weeks. The 6 weeks visit, whenever there is a fetal viability present, we do certain tests. These are done as the first visit tests, and this is called as the antenatal profile. This is usually in the form of the complete blood count, the blood sugar levels, the thyroid levels, the TSH levels, the serology, that is the HIV, HbSAg, HCV, and VDRL, and the urine routine and microscopy. So all this may show certain changes once you are confirmed with the pregnancy, and therefore this is very important. There are certain associated conditions, like if the IVF was done for luteal phase insufficiency, you need to take the medicines which will give you luteal phase support, and all this will be advised to you by your doctor. Certain things which come to our mind is regarding the anxiety associated with our what diet we should have, what how much rest we should have, what is the amount of exercise we should do, and are there any number of tests, what signs and symptoms one feels. So these are all queries, and these FAQs are quite well answered by the consultant in charge of you. So, not everybody will have the nausea, vomiting of pregnancy. Not everybody will experience heaviness of breasts or heaviness, general heaviness. So, all these symptoms are there during this period of around 6 to 8 weeks. Not necessarily that you should feel these symptoms, and it's better not to ask another pregnant lady regarding this. It's better to ask your consultant. It's better to take and read authentic articles. So regarding diet, we have little bit nausea associated with pregnancy during this period, and therefore we don't advise any hard core diet for these patients. So usually, the diet which is favored by the patient is advised. A healthy diet is advised. The foods which are prepared at home are the most beneficial one. We should avoid too spicy, too oily, too sweet foods. A high protein diet with ample of fresh vegetables and fruits, along with plenty of water, forms the diet of pregnancy. So this is going to remain as it is. We'll see as the second and third trimester advances what changes we need to make in the diet. Regarding the rest, so IVF conception, there is one misconception that you need to take complete bed rest throughout your 9 months of pregnancy for you to get a good success. Some people also advise rest during complete bed rest during the first 3 months. However, this is not the scenario. If we see the literature, studies have shown that complete bed rest does not increase your chances of a successful pregnancy. However, it may predispose you to the risk of thromboembolism, that is the formation of blood clots, if you don't move around. Therefore, it's very necessary that you do your day-to-day activities. Those who have their jobs and those who are not having uh, very hectic schedule, or maybe rigorous physical activity in their jobs, they can might as well join their jobs and do their jobs as and when required. Those who are IT consultants and all those who have they can do their work from home, especially in these COVID scenarios. That is favorable. Regarding rest, 8 hours sleep and maybe a 1 hour, 2 hour sleep in the afternoon is sufficient throughout pregnancy. Uh, Regarding exercise, you should avoid heavy strenuous exercise like jumping, skipping, dangerous sports like horse riding, bungee jumping, and so on. A regular walking or a jog is advisable and can be done. It should be done as per your consultant's advice. The yoga and other forms of exercise again should be done under medical supervision. All these exercises can be done, and you can have a healthy lifestyle during pregnancy as well. What special tests we need to do in our first trimester? So this is about first trimester. So first trimester is the period of pregnancy from as soon as your pregnancy is diagnosed, which is around 4 to 5 weeks of pregnancy, till around 12 weeks. Second trimester is the period ranging from 13 weeks to around 28 weeks. And the third trimester is the period from 29 weeks to around 40 weeks. So these are the periods of gestation which have importance in various aspects. So in the first trimester, that is around 12 weeks of pregnancy, we have discussed about the diet, exercise regimen. Regarding the sexual activity, so sexual activity should be we should be refraining from any sexual activity during the first trimester and the last 6 weeks of pregnancy. During the period in between, the sexual activity can be undertaken if the patient falls in low risk category. And during the sexual activity, barrier contraception such as a male or a female condom should be used, as the semen contains prostaglandins, which may initiate labor pains or false labor pains. uh, Regarding the special test to be done in the first trimester. So, towards the end of first trimester, that is around 12 weeks of gestation, we do what is called as a first trimester screening sonography, which includes measurement of nuchal translucency, nasal bone, tricuspid regurgitation, and uterine artery Doppler. All these things will tell us whether the patient is at high risk of any IUGR, growth retardation, hypertension, uh, and so on. Also, it will tell about any gross anomalies in the baby. If there are any certain syndromic babies, like if they are having some genetic problems. In two scenarios, we need to be very careful. One is when donor egg or donor sample is used for the IVF. In those cases, we need to know the age of the donor while doing this first trimester screening blood tests. This is called as the double marker testing or the first trimester screening, where we measure the beta HCG and the PAP-A levels. And this testing can be avoided in those patients who have already done pre-implantation genetic testing. So that is genetic testing of the embryo itself. So when we have done that, we may avoid this test. However, there is no alternative for doing a first trimester sonography, which is the nuchal translucency and nasal bone for that. In the second trimester, the embryo is quite well established. The blood flow to the embryo has been established. The placentation has started. The primary and the secondary layer of the trophoblast have already formed. The third layer of trophoblast or placenta formation will take place at around roughly 18 weeks of pregnancy. And this is the period where you should be taking lots of fluids. If you had a history of intrauterine growth retardation or a history of hypertension or preeclampsia in previous pregnancy, you need to tell your doctor that, so that certain special medications can be started during this period. High dose of calcium and vasodilators can be started during this period to prevent these problems. So, in the second trimester, regarding our diet, we need to take these changes. We need to increase the diet containing calcium foods, iron-rich foodstuffs, and also the doctor will start you on iron and calcium supplementation during the second trimester. In the first trimester, these supplements are usually avoided. In the fluid intake, your fluid intake should improve. Progesterone hormone causes urinary stasis, and there are high chances of urinary tract infections. Therefore, during pregnancy, we need to maintain our fluid intake and the urine output as well. In certain scenarios where there was a history of mid-trimester pregnancy loss, such as there was an abortion in the fourth or fifth month, this may be due to cervical incompetence or the inability of cervix to hold the pregnancy. This is avoided in the next subsequent pregnancy by putting a cervical stitch or cervical cerclage at around 13 to 14 weeks of gestation. So a doctor consultation can be done accordingly. If you had a history of polycystic ovarian disease and you were being treated for it and then you conceived after IVF, so in those patients there is a high chance of glucose test being abnormal later on. So impaired glucose tolerance test can be there, and therefore in all pregnancies we are doing glucose challenge test, and this is called as the DIPSI test in India, the Diabetes in Pregnancy Study Group of India, which has advised this test with 75 gram of glucose. You need to test for your blood sugar levels 2 hours after taking blood glucose. And if these values are more than 140 milligram percent, then there is what we call as the gestational diabetes mellitus. Those who are already having diabetes may not do this test, but monitoring of blood sugar by fasting and postprandial levels is must in these patients. So this is the special care. The special test what we do in the second trimester is the anomaly scan. So here we look for the gross anomalies of the baby. Here I would like to stress that there are no side effects of IVF per se with regards to the congenital anomalies. So IVF or ICSI will not increase your chances of having a congenitally abnormal baby, and the risk is as same as normal pregnancies, which is roughly around 5 to 10%. These anomalies are ruled out, gross anomalies are ruled out on a anomaly scan, which is done at around 19 weeks of pregnancy. In India, we have the authority of termination of pregnancy till 20 weeks. So, suppose if there is a gross congenital anomaly and the fetus is not sustainable, then the termination can be done during this period. And therefore, a scan at around 19 weeks is must. After that, in the second trimester, there is a scan which is ultrasonography, which is done at around 24 weeks, where the heart development takes place. This is called as the fetal echocardiography. Fetal echocardiography is not must in each and every case, and this can be decided on case to case scenario. So this was about your second trimester, where you also have taken immunization during pregnancy. Injection tetanus toxoid and a second dose of uh, DPT vaccine can be taken during this second trimester. This is called as a Tdap vaccine. In the third trimester, the requirements will increase. The fetus has already grown, all organs have developed. Now is the growth which is going to occur. So we have already all the cells which are there. Now the hyperplasia of that will occur. So the growth will occur, and in that case we need to take a very proper precautions regarding our diet, exercise, and rest. This is the period where the protein requirement, the calcium requirement, the iron requirement will exceed too much. The fluid content of the blood will increase, and this fluid content rises out of proportion to the RBC content, and therefore this is the period which is called as the physiological dilution of the hemoglobin percentage, and we have what is called as the physiological anemia. So to prevent any complications arising from it, we have to have hemoglobin percentage which is take at this level, and the iron supplements are adjusted accordingly. In some patients, if there is anemia which is diagnosed and the iron supplements are not acting in a proper way, we can resort to injectable iron preparations. A diet which is rich in iron, calcium should be started, and the protein requirement increases to 1.5 gram per kilogram of body weight. So, if a patient is weight of around 50 kg, the protein requirement will go to around 75 gram. And mind you, in Indian diets, we don't have diets which will give that much of protein. So in this scenario, you may need to have started with protein supplements which are specially meant for pregnancy. So you have protein powders, protein biscuits, and protein shakes which are available, which can be followed to help you in the high protein diet. Regarding the liquid intake, so as we all said that the pregnancy predisposes you to urinary tract infections. So this is the period where you need to take a proper genital hygiene and improve your liquid content as well. Any sort of infection should be treated as early as possible. Otherwise, these infections like urinary tract infection, dental infections can predispose you to preterm delivery, and preterm delivery can later cause problems for the baby in form of NICU admissions and neonatal morbidity. Now we'll consider about certain specific tests first before going to special scenarios. So in the third trimester, we assess the blood flow to the baby. We assess the fetal movements which are to be taken. The count is to be maintained by the patient, and we assess the growth of the baby. So fetal growth scan is done as and when required. A fetal Doppler, which indicates the blood flow to the baby, can be done, and certain conditions can be diagnosed like the growth retardation. If there is any fetal anemia, if there is any hypertension, then accordingly you will have growth retardation. If there is a patient is having gestational diabetes mellitus, the baby weight will be a little bit more. The amount of amniotic fluid or the liquor around the baby will be more. So these are the side effects associated with. So as we know that IVF pregnancies have a little bit high risk in the form of the age of the patient might be high for those who are taking treatment for pregnancy. There, the patient might have any previous existing disease. There is high likelihood of obesity, hypertension, diabetes mellitus, any thyroid disorder, and this can cause some problems during the antenatal period. Also, those patients who have a history of thin endometrium or Asherman syndrome, the placentation can be poor, and these patients can land up in growth retardation later on, or maybe adherent placenta also is possible. So all these factors which have an increased risk in IVF pregnancy needs to be ruled out in the form of intrauterine growth retardation, preterm birth, placenta previa, um, adherent placenta, and so on. So now we'll consider about special scenarios in IVF pregnancy. So we know that the risk of multi-fetal gestation in IVF increases, and if we do a single embryo transfer, this can be prevented. But whenever we are going for a single embryo transfer, there is the success rate also decreases. So we have to wait. We have to consult with the couple and then decide about whether we should go for a single embryo transfer or a double blastocyst transfer. If it is a double blastocyst transfer, nowadays we are avoiding cleavage test transfer where doctors used to transfer 3 or 4 embryos. So that scenario is gone nowadays. Regarding double blastocyst transfer, the risk of multifetal or twin pregnancy will rise to the tune of 30 to 40%. So if there is a twin pregnancy, we need to be careful. If the cervix is a short cervix, if there is a history of preterm birth in previous pregnancy, and the cervical length is less than 2.5 centimeter, we may have done the cervical cerclage prior. And a special care during this 6th to 7th month transition has to be taken in this period to avoid preterm birth, to avoid risk of any infection. So that's why I stressed about any form of infection in IVF conceptions, like urinary tract infections, dental infections, usually again predisposed to preterm birth. If your age is high, if you have done IVF for any thrombotic disorder such as thrombophilia, you may have to continue with certain special drugs which will improve blood flow to the baby and will not cause any mishap during the pregnancy. This is in the form of low dose aspirin or low molecular weight heparin only in indicated cases. If you have had a previous recurrent implantation failure or previous repeated IVF failures, then certain special medications may be advised to you in the form of steroids, in the form of immunotherapies like intravenous immunoglobulin, the Varglov or the intramuscular immunoglobulin. Then we have low molecular weight heparin, low dose aspirin. So these can be used in special situations like the recurrent implantation failure and recurrent pregnancy loss. So this was about the monitoring during pregnancy. We'll talk about the mode of delivery. The most common question asked is about the route of delivery. So it can be either cesarean section or a vaginal delivery. And there is no special indication that IVF pregnancy has to undergo a cesarean section always. So this is decided as per your need, as per the obstetric indication, and if any patient related indication. So if your age is too high, if the pelvis is not adequate, the ligaments will become the ligaments will become a little bit tougher as the age advances. So in those scenarios, we may have to go for a cesarean section. But if all things are well, the pelvis is roomy and the age is less, in those cases where there is no obstetric indication, a vaginal delivery can also be tried for. However, it's the responsibility of all of us to prevent fetal distress in either of the scenario. So, friends, this is about antenatal care during IVF conception. I would welcome any questions on this topic. Yes. So the first question is how frequently we have to visit our doctor for follow-ups during IVF, during pregnancy by IVF. Usually, in the first trimester, the follow-ups little bit increase than the routine pregnancy care. This is because we need to be sure about the implantation. We need to be sure about the presence of cardiac activity. So usually there is a monthly follow-up till the 7th month of pregnancy. After the during the 7th and 8th months, we have 15 days follow-up, and during the 9th month we have a weekly follow-up. So this is routine antenatal care. There is no much change as against the routine antenatal care. But in IVF conception, in the first trimester, during the first 12 weeks, there can be a little bit increased frequency of follow-up on a case-to-case scenario, and this will be guided to you as and when required. Yeah. So the question is how different is IVF pregnancy than normal pregnancy? So usually, as I said, IVF conception doesn't differ much in many of the scenarios. It behaves as equal as a normal pregnancy. The risk of congenital malformations, the risk of having a successful pregnancy doesn't change as per the normal pregnancy. Only in certain scenarios where the age is high for doing IVF, we have had a previous history of any medical disorder, if there is a history of any thrombophilias, if there is a history of recurrent pregnancy loss and recurrent implantation failure, we need to take special care in these pregnancies. I think I answered this question, how frequently we have to visit. Can we have the next question? The next question is it available in Patna? So we have our center in Ranchi, which is the nearest center to you. The next question is, do we have options of delivery at IVF clinic as well? So certain IVF centers do practice deliveries at their center. Since Oasis Fertility is exclusively a fertility center, we can provide you antenatal care throughout your pregnancy, but your delivery can be planned at some other center. So generally, fertility clinics who are full-fledged into fertility care and research, we tend to avoid obstetrics because again these are two specialty branches right now. The next question is it possible to have normal delivery in IVF? So as I said, yes, it's always possible to have a normal delivery in IVF. Only in cases where the age is high, we have certain obstetric indications like if there is a twin pregnancy, if there is a pelvis which is not roomy, and so on, we may have to go for cesarean section. Otherwise, you can have a word with your obstetrician and they can plan a normal delivery in every case. Can diabetics go for IVF? Is then yes. If then, how much successful possibilities? So usually there is no contraindications for diabetes going for IVF. They can certainly go for IVF. Only thing is that their HbA1c should be controlled. So HbA1c levels are the values of your last 3 months of blood sugar level. So they will tell you the control you have achieved in the last 3 months. So if HbA1c levels are more than 8.5, these levels need to be controlled first, and then a patient can go definitely for IVF. Diabetes itself will cause certain problems in the gametes, both in the male counterpart and the female counterpart. So, if a well controlled diabetes is present, they don't have any problem for fertility. And yes, they can go for IVF. We can have certain medications which need to be started for them. Certain number of certain oral hypoglycemic agents which are used for diabetes may have to be avoided. So suppose you are taking some oral hypoglycemic agents which are not to be taken in pregnancy, these need to be changed to a safer alternative or sometimes to insulin before we go for a IVF process and the pregnancy per se. I think this is a repeat question. Can we go on to the next question? What precautions need to be taken in IVF pregnancy? So we have just now discussed about all the precautions. First of all, you don't need to be anxious that you have IVF conception. IVF conception in majority of the times will behave as a normal conception. So in IVF, only the process of pregnancy formation differs. The fertilization differs. Routinely, the fertilization is taking place in your body. Here, the fertilization is taking place outside. And then we are putting the embryo which is formed outside into the mother's womb. So in that case, the process of implantation becomes very important. This implantation process will take place and you will have a pregnancy result. So the implantation and the thriving of this embryo during the first trimester is very very important in IVF conception. Once you are through with your first trimester and if there are no other coexisting morbidities associated to you, the pregnancy will behave as a normal conception. So during the first trimester care, the second trimester care, and the third trimester care, I have already stressed in the lecture. You can again go through it. Can frequent sonography cause harmful effect on the baby? So usually sonographies are done as and when required, and they should be done only as much as necessary. The Doppler waves which are used in sonography, the Doppler principle, they have not shown to be causing any harm on the baby. So with adequate precautions and minimum number of sonographies possible, I think there shouldn't be any problem associated with sonography. Routinely, we do a confirmation scan, which is usually done at around 6 to 8 weeks of gestation. After that, we have a scan, which is ultrasonography, which is done at around 12 weeks, which is the first trimester screening sonography, where we check for the NT-NB tricuspid regurgitation, as I told. Then we have the anomaly scan, which is done around 19 weeks. If that anomaly scan is good enough, we may avoid the 24-week scan and then later on directly go for a fetal well-being or fetal growth assessment and a color Doppler scan sonography, which is done at around 28 to 32 weeks. A repeat sonography can be done in the ninth month. So these 3 or 4 scans might be sufficient throughout your pregnancy. Sometimes, if there is a high risk situation, we may have to go for more number of scans in those cases. How we know that the embryo has implanted? So as I said, after the embryo transfer procedure, the ET, the beta hCG levels are done 14 days after that, and once your beta hCG levels are positive, then you know that your embryo has implanted. Whether it is successfully implanted or not, or that will again that can be confirmed on ultrasonography. So these are the two tests how we can confirm whether the embryo has implanted or not. Is walking good after embryo transfer? So there is no problem, no harm in walking. As I previously said, absolute bed rest should not be practiced even after embryo transfer and even throughout your pregnancy. So a casual walk, a normal walk is recommended and can be done even after immediately after your embryo transfer. Is there any Mediclaim policies for IVF? So usually there are no Mediclaim policies right now available for IVF, but we have financial assisting services for IVF, and Oasis Fertility. We have a separate cell. Our branch can definitely answer you on this. So you can visit our branch, and we can arrange the financial assistance in other forms. What is the success rate of IVF? The success rate of IVF will differ from patient to patient. I have answered in my previous videos on IVF also the process of IVF and the success of IVF. Routinely, if the patient factors and the male and the female partners both favor us and we have a good embryo, at Oasis we have given a success rate which is way above the world average of 50%. We are crossing more than 70% success rate. So that is a routine success rate. But for each patient, there will be an individualized success rate depending upon multiple factors. So I think the questions are done. I thank you all for a patient hearing. As always, I will wish all the moms and all would-be moms a great salute to your motherhood. Thank you so much.